Morning, folks. It's no time like the present to get this party started. I won't hold us up, and Senator Marr will be a few minutes late. And when she comes on, please everyone inundate her with happy birthday wishes. I like to shame her as much as I possibly can publicly, and I would like that recorded for the public record, of course. We're meeting today for the working group to review available data and information regarding the effectiveness of the Department of Children and Families in discharging its child protection responsibilities. As we know that this is one of the most critical agencies to our states, as it is in regard is it is related and in regards to our children and families. And so this was a working group that was put together many moons ago, and we are now finally getting to move forward with its meeting and findings. With that said, I'd like to first acknowledge, of course, all of the folks here from the agency. And then once again, moving forward, we have the DCF designee, which is Zachary Thorne, and the OCA designee, which is Brendan Burke, with us, as well as both of the agency representatives, both Vin Russo and, of course, Christina Guillo. Uh, I now convene in the meeting at 11 a.m. Those were my remarks as a chair. I'm sure Senator Marr will have remarks at some point for which we will follow through and follow up with her on that. And oh, here she is, Senator Marr.
Sorry. I'm so sorry.
I
This
was just
trying
moving off of the chair's remarks, ma'am. Uh,
Okay.
Happy birthday to you.
Oh, thank you. I
21 is a
appreciate that.
miraculous year, so I hope you enjoy it to the fullest. Do you have any remarks before we get started?
No, just that I'm looking forward to hearing from DCF on these concerns and also from the Office of Child Advocate. So thank you very much. I'm going to
Thank you,
go
ma'am.
put myself on mute till I get to the LOB. Thanks.
Thank you, ma'am. I appreciate it. Uh, Moving forward, we'll now go to item 3 on the agenda, which is the DCF service availability, timeliness, and effectiveness report. I will move it over to Zachary Thorne for any welcoming remarks, and then Vin Russo or whomever Vin deems necessary to update us for that report. We'll move forward with the first with those agenda items. Zach, and then Vin. Thank you.
Uh, Thank you, Corey. My name is Zachary Thorne. I'm the Quality Improvement Program Supervisor for 4 of the area offices at DCF. I want to thank you for convening this meeting, to the committee members for participating and giving us the opportunity to speak about our services and the strengths, the challenges, and the opportunities that we're working on. Thank you. I'll send it over to Vin.
Thank you, Zach, and thank you, Representative Paris, and happy birthday, Senator Marr. I hope you have a great one today. And just want to say thanks to both of you for convening this meeting. I think at this point, Zachary will be kind of leading the talking points from our perspective as far as the agenda bullets. Obviously, after this meeting, we'd be happy to provide additional information or documentation once we have a better understanding about the specificity we're all looking at about particular areas. Obviously, we have a lot of data. And we just want to make sure that, when we're talking about it, we can talk about it in a very, a very formalized way, so that way we're getting to the issues at hand. And so with that, I'd be happy to turn it over to Zachary. And then obviously we do have several members of our team here that kind of have different components of all of these points that over the course of the meeting will be happy to share their experiences and their expertise on the various items. Thank you.
Thank you, Vin. And Zach, before you start, I do want to keep us and be mindful of the taxpayers' dollars with CTN and keep us to an hour if possible. So any additional supporting documents that might come up in conversation through the course of this working group, please submit those to us, and then we can follow up with the next working group meeting. But Zach, you can start off with information with oversight to the access to behavioral health, developmental, and educational services. Thank you.
Great, thank you. So I'll give you an overview of access to behavioral health, developmental, educational services, and then I'll move into capacity issues, wait lists, and the effectiveness of services provider. So to start, when talking about access, we need to talk about our assessments. This process starts at the level of family visitation and interaction with our family to identify their needs and their strengths. So in doing our assessments, when a family is in need of services to support their needs, we have access to consultations with experts within our work group, and those are called the Regional Resource Group. This includes mental health consultation, substance use consultation, intimate partner violence consultations, as well as enhanced service consultants and educational consultants. When we hold these consultations, it helps us to identify the best service to support our families and address their needs in a timely way. And we have 80 service types with 95 different providers. And we have a staff service directory that is provided to our staff. And it really gives a clear description of each contracted service, the gatekeepers, and there are also community-based services as well. So it's a team process to identify the best services to address our family's needs, and then referring them to those services. Next, I'll move on to capacity issues and wait lists. As I mentioned, we have a very robust array of services. Again, 80 service types with 95 providers. We do our best to maximize the utilization of these services. We do that through regular communication with area office staff about openings and wait lists. Each office has point people to communicate to the staff directly. But with this large array of services, not all services always have available slots. There's a multitude of factors that affect available slots. Sometimes it's with the provider themselves with staffing issues. Some of these services are really in demand because of their effectiveness, and the slots are fully utilized. And some of those services have wait lists. With our practice, we do our best not to have people sitting on waiting lists. That's not a common practice. So when a family needs to have their service needs addressed, we make alternative arrangements with the other services that are available to make sure those needs are met. So we quickly refer them to alternative services. Sometimes the primary service, we will put them on a wait list so that they can access that service at a later date, but we really just don't want them sitting waiting for treatment and support. We do have processes in place to track the needs and slots of our services so that we're keeping track of services where we do have wait lists, where we are maximizing our capacity, and we potentially may need more slots for those services. Next, I'll move on to the effectiveness of those
If we could go
services.
back for just 1 minute,
Sure.
Zach, could you just tell us what are some of the challenges that you all are facing in terms of providing those services, and what is the plan to build out those services to meet the need and to bring it to scale?
So some of the challenges with those services, again, as I talked about before with slots, providers are not always fully staffed. DCF, we've done our best to keep our staffing as high as we can, but those same challenges are present with our providers. So when they are in the process of hiring, we don't have full access to all of the slots that we're contracted for. Again, there's excellent services that are quite popular, quite effective, and we only have a certain amount of slots available, and we maximize those slots. So we keep track of those to try to enhance for more slots at a later date. And then in terms of our internal process to try to improve on accessing those services, we try to shorten our referral time frame as much as possible. We want that to happen as quickly as possible, but it is an area of opportunity for us to improve on.
If you could provide me and Senator Marr with just an overview of how that workaround is happening in terms of trying to shorten the referral time frame, I think that would be helpful for us to know. And I saw Brendan Burke's hand up. If you don't mind, Zachary, I'd like to just jump to him in case he had something related to the topic at hand.
I do. Thank you, Representative Paris. Zach, you mentioned, good morning, good to see you. You mentioned the effectiveness of programs. And I think that's a very important understanding that this group needs to have and the state needs to understand on what programs are effective, how do we measure that effectiveness, and how that's tracked over time so we can resource appropriately.
Absolutely. Thank you for asking that question. And so that I can clarify, we have a system called PI, where our providers, our contacted providers, enter information generally through surveys about their performance and outcomes. We keep track of outcomes through our scope of service, but we also have key performance indicators for each one of those outcomes where providers input that information to our system. So this system, it is managed by 28 program leads to make sure that the information being inputted is accurate, it's consistent, and it's complete. And then we take that data, we export it, the program leads review it and create annual reports to really analyze the effectiveness of the services. Generally, with our reports, we find that there's some really important factors in whether the service is effective or not. It is typically when a family completes the service, fully attending. And when we see that, there's generally a lot of progress with that family. Two of our biggest barriers with having services be effective are client refusal of those services and then accurate assessments of those needs.
Do we know why there's why client refusal is a barrier to the services being received?
There's a multitude of different reasons why. I don't have quantitative information for you, but I can speak to some of the examples. Sometimes families just are not at the point where they're invested in making a behavioral change.
Okay.
There's other issues with transportation, which we try to help with for those services. There are issues with there's language issues where we can't get them engaged in the right services at times, which we're also working on.
And I hope you don't mind me being direct when I say this. These all seem like challenges and barriers for which we have resources to help people overcome in order for them to get the services that they need to remain in good standing and in good and stable. So are some of these challenges that are being faced, are we trying to right the wrongs on those challenges for folks? And have we seen us trying to offer them those resources and then they still push back on wanting to accept the services?
Absolutely. We have multiple conversations throughout our case management about the progress of engagement in the services, their barriers. We offer what we can do to help them. Many of those things are within our opportunity to assist them with. There are direct refusals. So when I talk about refusal, I mean directly. There's also passive and indirect refusal. So there's referring to the service, attending but not attending consistently, or saying that they will attend and just not engaging in the service.
Okay, thank you. Please carry on with the rest of your overview. Thank you.
My pleasure. Thank you. So that pretty much, through the questions and what I went over, pretty much covers the access, capacity, and effectiveness of the services.
Zach, can I just interrupt you for one moment?
Absolutely.
Sorry. Dr. Dixon, Linda Dixon is with us, and she also has a perspective and I believe some other things to share that might be a helpful additional context to this conversation. So Linda, did you also want to
No, thank you, DC Gerber. I'm Linda Dixon, and I work in the Commissioner's Office, and I've been sort of working on a project to consolidate and shore up the QI in this area. So as Zach already outlined, there's about 85 different contracted service types, plus a host of credentialed services representing a third of our budget. And we've got about 300 individual programs out there, and this, like I said, represents a third of our budget. Zach mentioned some of the wait lists, and we often hear about some practical challenges that families face with access. Primarily transportation comes up quite a bit, and we've been working with our central transportation unit. We've been working with our staff again, but it's just amazing to me. It's a small state, but transportation and getting somewhere where people need to go continues to be just a regular barrier that we hear about. There's also a constant conversation that we have with our providers and trade association meetings on the staffing and the recruitment and retention issues that we see in human services. That has a direct impact on service and when people are able to access and enter a service. So we've been hearing that and meeting with our provider partners quite a bit on how to work through that and how to use funds to incentivize hiring, especially a diverse workforce. I think the only other thing I would add is Zach mentioned PI. Thank you, Zach, for mentioning that. That's the provider information exchange, and that does track some of the basic information on utilization, and we're doing an expansion of that to cover most of our contracts in the next couple of months. So we will be able to automatically track utilization, right? So we're pretty good at tracking the how much piece. It's the better off that you referenced earlier that we really want to drill down on. And that stuff is reflected in Program Lead's annual report. Zach mentioned there's 28 program leads in the department. They do an annual report reflecting utilization, staffing, and now a little bit more on the outcomes. And that's what we really want to ramp up to make sure we're funding the right services. We have a really good complement of the evidence-based services, but many of our youth don't fit in that box anymore. Even though we get good outcomes, we want to be able to create certain individualized services. And I think that's where the credentialed work comes in and our ability to kind of pull different things together. So I wanted to just point that out for you. We have various ways to review programs on an annual basis, and we also review the outcome measure annually.
Dr. Dixon, I appreciate this. I would like to see, and I think I might be speaking also for Senator Marr on this, I think it would be important to see the geographic outcomes on this. It's really important if we're talking about services to see where the most need is based on transportation, based on all of these additional resources to provide to families. So if you could send that to us, I think we could have a better understanding of the scope of where people are falling through the cracks and where we need to beef up services. Senator Marr, you have the floor, ma'am.
Thank you. Appreciate Rep. Paris. And thank you for holding down the fort on the meeting so far. I have two questions. Actually, when we're talking about services, there has been recent reporting about homelessness and the impact of children being removed from their parents because of homelessness, living in cars, similar situations. And one of the reports that I read spoke to the fact that you had a family, they were given housing, there was a 3-month lag from the housing provision until the family getting into the housing. And I look at that and I think the impact on children, the impact on these families, what are we needing to put in place? What kind of additional services are we needing to put in place so we can get them rehoused more rapidly? So that's my first question. I don't know who wants to take that one.
I can start, and then maybe either DC Gerber or Vin can kind of augment this. I'm more familiar with the adolescent housing, so we work very closely with our partners, the Department of Housing, and we have an MOU where there's contracts with a provider organization. We secure vouchers as well for young adults and for our families. We can always use more access to federal vouchers for housing. That's something that has sort of been on our radar for a couple of years, and every time we have an opportunity to work on getting more vouchers, we certainly do that. But we work very closely with the Department of Housing, and anytime we've had the ability to expand our budget in the START contract, we've tried to do that. So that's really what I can say on housing. I'm not sure if you want to add anything, Ben or Stacy.
Yeah, hi. The only thing I'll add, and good to see you, Senator. The only thing I'll add is that we did get a request for some data from the Children's Committee that we are pulling together. We want to make sure that we have the universe covered. I will say we did see the reporting, and we actually spoke with that reporter, and we thought that there was some information that wasn't exactly spot on. I will say where housing is a factor on occasion, and we were looking over the last several years, and in about a little less than 500 cases, it was a factor, but not the factor in removal. There were 32 cases over the last several years where housing kind of was the primary factor, and we look at that very closely. We do have a housing division here that works very closely with the Department of Housing to ensure families are able to access safe and affordable housing. So those vouchers do come in handy. Obviously, the more we get, the more families we can serve, clearly. And we are very interested too to see it's also not just a question of vouchers, but access too. So we are all watching the recent housing bill that passed to see how that helps with development of additional affordable housing units for these families that desperately need a safe place to live. But I do see DC Gerber's hand up, so I will let.
If I could jump in for just one quick second, I think the rest of the state that's watching this, they need to know about this. And Senator Mara, please forgive me for jumping in on your question while you were asking your question. I apologize. But I do think it's important for us to be pushing out the program, the stable housing program that builds this co-agency consortium between DCF and DOH. I mean, it's been around for more than 20 years. It has obviously saved the state a lot of money, because what people fail to realize is that when we are breaking up families and not keeping families unified, then we're spending more for mental health needs, more in emergency services for the hospital, more in food insecurity needs. All of those things we're paying for it on the back end, and it's not smart money and a not smart investment that we're making. So I think what also needs to happen from this end, either from this working group or from both of the agencies, is that we need to be putting out more information about this program, not necessarily as a crisis management solution, but just as a resource for families. And because people don't know about it, I think that we lose more people to homelessness because they're not aware of the program. But we also need to bring the program to scale. And so if we can get a report directly on how much it would cost for us to invest more dollars to serve more families, so that we're not seeing families broken apart and that they are reunified, I think that would be helpful for us moving forward. I'm sorry, Senator. I just wanted that on public record.
Thank you. I appreciate that as well. Stacy, do you want to speak? And then I have a second question. No?
You can go, of course, the birthday girl, of course, gets to go first. And you get to go first on every day. So you
Oh
go
boy,
first.
thank you. Boy, I'm going to run this one into the ground today. So the second question really is around data. I mean, I know that you just put in place your new reporting systems in August, I believe August of this year. And I'm curious when we're going to start seeing the data on all the different programs, who's being served, where they're being served, all of the information that we've been waiting on as you ramped up this new system. So I'd love to have some information on that.
So I can answer both. If I go back for 1 second, just on the housing issues, obviously the department, and by the way, for those of you who don't know, I should have started with this earlier. I am Stacy Gerber. I'm Deputy Commissioner here at DCF. On the issue related to housing, this is something that is so near and dear to my heart. I helped start the supportive housing program for children and families here in Connecticut back in 1996 or 97. I also have spent years as part of the National Center on Housing and Child Welfare, creating housing opportunities for children and families throughout the country, including the project that was here in Connecticut, which was the Head Start on Housing. DCF does obviously fund our housing programs, and when we are involved with children and families, we have been expending dollars to pay for rents, both short-term, some a little longer term, having our partnership with the Department of Housing, utilizing vouchers and ensuring in partnership with the Department of Housing and our private providers that our families get housed, because the access to the vouchers, as we all know, is one piece that's very important. But once you get the voucher, and I've worked with families directly for many years, it's like, yay, and now I need to be housed. So what supports? So we have been, and we could also be pulling some reports to help show the work that we've been doing related to making sure families in the DCF who are involved with us here at DCF aren't coming into care solely on a housing issue, or they are not having delays in reunification around that housing issue. So we need to continue to make sure we're maximizing that and taking a look at what's needed, which is some of what you all are asking. We have some data on that. That data is not part of our new CT kind system, but it is information that we can put together, and we need to continue to maximize as many resources as possible, because we all know that impact, Representative Paris, you just talked about it, of how housing is key for many of our families. I spent time with homeless families here in Connecticut, walking through the process with them to see what the 2-in-1 system was doing, where they were, what was happening, to really embed myself in understanding that. So we're happy to try to put more information together around what we have been funding, both, as Dr. Dixon mentioned, related to vouchers and work with our older youth, but then also the resources we have been providing to DCF involved families. And many of those families, their DCF cases are closed, and they're still able to access those supports. So we'd be happy to get some of that information together as well. And then to the question you just raised, we did roll out our CT Kind system in August. Major transformation of our IT system with 3,000 users. We all know that's a bumpy ride on a good day. So we have been working hard. Unfortunately, right now, the reports piece is not where we need it or want it to be, but we are working daily on our reports piece. And then we are also taking a look at what information is coming from our CT Kind system and how we are matching up and utilizing to the best ability possible the other data systems we have. Zach had mentioned earlier, as did Dr. Dixon, our PI resources. We also have other systems collecting, and that is something at the top of our list on our data management reports. And I know when Dr. Dixon talked earlier about the work she's doing related to effectiveness and capacity issues with the work that's undergoing, the data collection piece and what we have and what we need is a big piece of the work that she's spearheading. So we are sure we can get that those pieces put together as quickly as possible.
Well, I'm sure there'll be more coming in terms of what our data requests are, and certainly I know we all look forward to seeing the information. This has been a long time in coming. Thanks.
Agreed. We're looking forward to it as well. We're happy to work in partnership to get what we all need and want.
Thank you. I thought the birthday girl was going to take over there for a second. I guess she really is going to milk this until the very end. Any other responses or any other information that will be useful to us under the agenda item 3? If not, I think it's fair for us to move on to item 4, which is an internal review, findings, and accountability. So once again, Zachary will walk through the summary of the DCF internal reviews, the recurring practices of system issues, and recommended action steps and implementation tracking. Followed by any questions for OCA, because I know that there is some cross work there, excuse me, that's being done with both offices. So with that said, Zachary, you have the floor.
Thank you. I appreciate it. So in regards to the summary of DCF internal reviews, I want to describe the different internal reviews that we have. The reviews include both quantitative and qualitative reviews, and include our administrative case review unit, our CFSR reviews, and then we have a case practice review unit that focuses solely on reviewing cases and providing feedback as to how we performed and highlighting area office performance as well. They look at differential response reports and also our in-home case performance. We also have SDM reviews, and at the local level, at our area offices, we have CQI teams who do reviews of cases that are open and closed to gather information about areas of opportunity and strategies to address those issues. I want to highlight in our recent CFSR review that our quality assurance system was assessed as a strength. It's one of a few strengths listed, and that in our CFSR reviews and our internal reviews, they have overlapping findings. We recently submitted.
Zachary, I'm sorry. I just want to. I'm sorry, Zachary. Does everybody know what the CFSR is? before we move forward? Everybody knows? Okay, good. Okay. I know sometimes we have a lot of alphabet soup in our language. I just want to make sure if there's ever something that is said that you're not aware of, please speak up and let us know.
Thank you, Vinny. So what we found in a lot of our reviews, our internal reviews, that they overlap with our PIP areas for improvement. We recently submitted our PIP report on November 3rd, and we're currently awaiting the review and approval by the Children's Bureau. And those areas for improvement really break down into 5 different areas. Safety and risk assessment to prevent entry and reentry, permanency in 12 months, family engagement and case planning. Specifically, we can improve on our fatherhood engagement and, as we talked about before, our service provision.
And with the fatherhood engagement, are you all working with any other organizations across the state to help do that work? And can you just send us, are there multiple organizations? Is it one in particular? Could you just let us know who's partnering with you on that?
We have multiple organizations that we work with and consultants that work directly with our staff and also have trainings. They help guide us in our fatherhood practice and our quality improvement efforts. So they're partners, not just someone that comes in and trains. I'd be happy to get you a list of those providers. I don't have them offhand right now, but we have some providers working with certain regions around the state. And then we also have our fatherhood enrichment service that works directly with the fathers on our caseloads.
Thank you.
Thank you. Within our reviews, there's some additional crossover themes. So as always, we're focusing on areas that we can improve, including supervision quality, workload challenges, our engagement efforts. I just spoke about fatherhood engagement. We spoke previously about access to service process and availability, and we're also focusing on placement stability. I'd like to turn it over to Nicole to talk about some of our PIP goals. I spoke about recently submitting the PIP report on 11/3/25. Nicole is the Director of Quality Improvement, and she can speak to the PIP goals.
Excuse me, Zachary, before Nicole speaks, I just wanted to ask, you told us what the positives were in the CSFR, I'm not sure I got that right, report, but where were the pieces that you needed improvement? I think it's equally as important to talk about that as it is about where you were successful.
Absolutely. And thank you for asking that question. And I forgot to say happy birthday earlier. Happy birthday.
Not necessary. Thank you.
Folks, I think it's overkill on the happy birthday piece already. No, I'm just teasing. Go ahead. My apologies. I just have to pick on the senator for a moment.
In terms of our areas of improvement, the safety and risk assessment to prevent entry and reentry, those are areas that we were focusing on. We have PIP improvement groups formed to address these areas as well. We are focusing on permanency in 12 months. So when kids come into care, successfully reunifying them within 12 months and having them stay at home. We're focusing on improving those numbers. Our family engagement and our case planning. Our family engagement and case planning. So making sure that we're not just engaging family, but we're showing them the path to successful closure of their case, resolution of their needs, and making sure that their kids remain safe at home. And that includes fatherhood engagement and working on our service provision. So we are working on trying to shorten that time frame for when families are referred to services and that they successfully complete those services with significant behavioral changes.
And we can provide our PIP to the committee as well. It is a public document, so we'd be happy to provide it. In fact, I think we even had a meeting at the LOB on it not too long ago, because we are working with not just internally, but with external partners and others on developing strategies to address some of the issues that Zachary just listed that are identified in our PIP.
Thank you. And so, as I mentioned, we formed PIP subcommittee work groups around those 5 areas of opportunity. And we now have a PIP strategy implementation team to address those 5 areas as well.
Thank you.
And I see some hands up. I'm happy to pause to let others speak.
Yeah, Margaret, why don't you go first, and then Stacy, we can go to you right after.
Thank you. I just wanted to make sure everybody is aware that the Connecticut Alliance of Foster and Adoptive Families has been working really closely with the department in making sure foster parents are trying to do everything they can, including having support groups with dads, including having support groups with moms, to make sure that kids can return home to their own families as much as possible. It's not going to happen every single time, but that is a central part of our mission, and we are working really hard with the department to make sure that biological families and foster families work together to make sure that kids can go home.
Thank you. Stacy?
Thank you very much, Rep. Paris. Thank you, Margaret, for highlighting that as well. A very important piece. Just to close the loop a little bit on our program improvement plan, as we affectionately call the PIP, we did submit our draft to the feds. They are currently reviewing that. They've had some office staff changes at the Administration for Children and Families. We're now working with folks out of the Philadelphia office, but we've had several meetings, and we have one meeting the first week in December to get their formal feedback on the strategies we provided. So we are happy to provide you with our current draft and keep you informed around the feedback we get from ACF and what changes we'll be making. But as Zachary pointed out, we will be having a PIP strategy implementation group, and we are incorporating, Zachary talked about the many ways in which the department's Bureau of Quality Improvement has reviews where we touch families and cases very regularly. We're consolidating the reporting information and making sure our strategies and our implementation team are looking at those cross-cutting themes and how we can continue to move forward with the work. So there's more strategies that are even in that PIP, but again, happy to share each draft as it is moving forward, and we will let you know once it's finalized and formalized and it becomes accepted also by the Administration for Children and Families.
Thank you, Stacy. I'm sorry, I don't know your first name, Indianis.
Oh, hello. Thank you, Representative Paris. And hello, everyone. Actually, DC Gerber really just spoke about what I wanted to add about the PIP, but I just did want to highlight 2 quick pieces of information. And thank you for the opportunity to speak on this. Part of the extensive work we did around our CFSR planning and in preparation for our PIP, our program improvement plan, was we had many stakeholder meetings and stakeholder interviews with different groups, including our foster parents, including our providers, including a group specifically with fathers, really to seek their feedback and their input about, their experiences with DCF, how we can improve our service delivery, how we can better improve our services to children and families. And I think that we've been making definite strides in terms of also including all of our external and internal partners, making sure that they're all aware of our data, making sure that we're sharing. So we're not just eliciting feedback, but we're also saying, here's our data. This is our current data on our performance, and we want to seek your input, your collaboration, your partnership on how to help us with strategies. So one other example of that quickly is that currently we're regularly sharing data now with the SAC, the Statewide Advisory Council, and also the RACs, and making sure that that data is being disseminated out statewide.
Thank you so
Nicole,
much.
Nicole, would you introduce yourself, please? I'm sorry.
I'm sorry. Yes. Excuse me. Yes. Thank you. Nicole Dionis. I'm the program director for quality improvement within the CQI division.
Thank you, Nicole. I didn't want to keep calling you Indionis.
Thank you.
I would have been ripped for that on Capitol Report. Thank you so much. Anything else, Zachary, in terms of the report from agenda item 4? If there's anything else that had not been shared, if so, please continue to do that. If not, we can move on to OCA for some of the questions that they have.
No, I think through our conversation and through the questions being asked, we talked about the action steps and implementation tracking. So I appreciate that opportunity, and I think we can move on.
Thank you. Brendan and Christina, do you all have any questions and or remarks?
Thank you, Representative Paris, and thank you, Senator Marr, for both of you for getting this meeting set up and working on these issues. I think for our office's perspective is that this issue in terms of what data is available and what can be publicly shared is important to the mission of DCF, right? And sort of and so I want to sort of provide a little bit of context and some comments in terms of what we've already talked about. You know, our office advocated for more public dissemination of DCF's data in the follow-up to the death of Liam Rivera. And in part, we did that because the state previously had sort of ongoing external quality assurance through the 1F Court Monitor's Office, where data was regularly published and reviewed, and there were sort of identified outcomes that the state was working towards. And with the loss, the completion of the consent decree, which was in place for 30 years, and the loss of that court monitor's office, some of that public reporting does not happen in the same way, right? So that was one reason. I think the other reason was that we believe the public policy conversations really need to be informed by all of that data, right? There's the CFSR that we've talked about, which is a public report and is, there's a program improvement plan. Those generally come out, the federal CFSR is done every it's periodically, so like 7 years-ish. And so it's important to think about what the other data sources are in between. DCF mentioned some of their internal quality assurance, the in-home case reviews, and the DRS reviews in particular. Our office views is very, very important. They are looking at the quality of the casework in essence. And I think, we talked a little bit about the service array. And there is, I think it's helpful as we move forward to maybe think about things in two buckets, right? There is what is the safety and well-being information, and then what do we know about service array? And when I talk about safety and well-being, the way we look at it is there are certain pieces of casework that are foundational and critical, and they are reported on within some of this quality assurance work that DCF is doing internally. And that includes, from our perspective, the sort of three legs of the stool, right, would be, are caseworkers visiting in accordance with the policy, both quality and quantity of the visits? Second, are caseworkers making collateral contacts consistent with the policy, right? That's calling the doctor, getting the information from the school. And third is supervision. And is the supervision happening in accordance with policy? From our perspective, that is the foundation of the sort of basic case practice that you can't get to all the other stuff without those three things happening. And so DCF does have data on that. And I think it would be helpful for this group to be able to look at that data, understand what it tells us. What are the areas that DCF is working on as a result of that data? There are areas that are areas of concern. We included some of that in the Liam addendum that we issued last year, but I think it'd be helpful for this group to hear that data from DCF to understand kind of what it tells us. And most importantly, there's sort of if case practice policies are not being met, why and what do we need to do about it, right? Is it that there is a staffing problem? Is it that there is a resource problem? Is it a service array issue, right? Looking at that level so that we can use the data to drive whatever the system improvement is, right? If it's that we need more housing, because when we look at DCF's data and the sort of disconnect between doing the assessment of the family's needs and connecting them with the services they need, right? If you look at the CFSR, there's a big gap there between did DCF assess what the child needs and did DCF provide the services that the child needed? There's a big gap there. And so understanding exactly where those gaps are, and then allowing that to drive proposals, right? That, you know, if it's that we need housing, then we want to address that. And I think that's true with regard to all of those pieces. So I think we're and we talked about fatherhood engagement, which is another area. There's a policy on fatherhood engagement. There are some concerns with respect to the adherence to that policy based on the internal data. And so what steps can be taken, right, to ensure that that's occurring. So that's really, I think, our perspective. And so I think it would be helpful to talk about whether that data could be shared here, and sort of thinking about, as I understand the charge of the committee, to really identify what should be disseminated, because the other piece here is sustainability, right? You know, the CFSR, prior CFSR, there were some areas of need of improvement. There was a program improvement plan. They improved. The program improvement plan went away. Some of those same areas were identified as areas in need of improvement with this CFSR. So I think that's the other piece and purpose to that sort of regular dissemination of data, is to ensure the sustainability of any improvements that are made. So I'll pause there, but I wanted to sort of put that information out for folks on the committee to be thinking about.
Thank you. Thank you, Christina. Are there any other comments and or concerns?
If I may, Representative Paris, so I agree with Christina 100%, focusing on the areas related to the visitation, collateral, supervision. And we do have lots of information here. And one of the things, as I entered this role and I'm taking a look at some of those areas, sometimes there's a lot of information, which is great, but it could also be very overwhelming. So one of the things we are doing is trying to focus, take a look at those data reports and that information, and helping to put it together in a way to help people to remain very focused on some of those issues. And I'm not sure, because I'm new to this role and new to this committee, what other information and data had been shared related to some of these issues, but we can talk about what is available and what we can share. But we are on the same page with Christina around the need to pay attention to those issues very specifically and ensure we're addressing any obstacles that are preventing us from, whether it be visitation or checking in with collaterals or supervision. Those are the foundations. And we know we need to remain focused and use that information to, whether it is, do we need new resources? Do we need to realign our resources? What are the things inside our control that we do need to be able to make some shifts around? And what are some of those things we need to work in partnership with you all and others to improve? But starting with our information and doing a little consolidation, absolutely. And very well said, Christina.
Thank you all so much for those comments. Senator Marr, do you have anything else before we wrap up? Oh, Nicole Indianis, you're up.
Hold on, excuse me. Thank you. Thank you, Representative Paris. And I just wanted to add quickly, and Attorney Guillot, very much also completely agree with what you said. I did just want to add that every time there is the federal CFSR process, every single state in the nation does have a PIP, a program improvement plan, just to add, and we agree completely. And in fact, I just want to highlight, as Zach had said earlier, that there is definite parity between our internal review findings and the findings of the CFSR review. So we're happy with that. There's agreement. We understand and agree with what we need to work on. Just wanted to add that we're not unique in having the PIP at all. So just wanted to share that. Thank you.
I think that is important for us to hear. And I think what's also important for us to know as a legislative body and for the public to know, especially given where we are in terms of many challenges that we're facing as a state, and certainly you all as an agency, it'd be good to know how we match up against other states across the country, where we are in terms of the rank of the performance improvement plan, where others are, and who has similar a similar track in terms of their improvement. I think that would be super helpful for us to know in terms of knowing how we need to move forward. Zachary.
Thank you. I just wanted to add a couple more pieces of information in terms of what Attorney Guillot said. I also completely agree, and it's an area of focus that we're working on in the area offices and our CQI systems. But with our case practice review unit, we do have reports that we put out regarding the quantitative and qualitative reviews of our in-home cases and our DRS cases, where we really summarize the results of those reviews. Those happen ongoing. They're released every 6 months. So we do try to put some of that information out there that summarizes the reviews that we're doing. Those reviews also encompass a lot of the CFSR metrics for looking at the quality performance of our casework. And then we have other CQI initiatives in place that we're working on. We mentioned before with visitation. We're looking at individualized visitation as well, not just whether we went to the home. So that's a CQI effort to drill down and be granular about our performance there. With our supervision, those are tools that help our supervisors manage our staff, ensure that we're doing quality casework, and engaging properly, engaging with our fathers. And then as we go through this process of quality improvement, we're developing additional tools, supervision tools, to help us make sure that we're adequately addressing the needs of our families and we're not just repeating the same things that we've always done.
Thank you, Zachary. I appreciate that. Margaret, I saw your hand up. You sure you don't want to take a stab in the last 6 minutes?
I just wanted to say that I'm sure everybody knows this, but the New England DCF directors and their staff meet regularly together. So they're sharing information with each other about what they're dealing with. And I know that they're not just alone with New England. They meet collectively throughout the country. I think there's a pretty solid network of people sharing information. So I just wanted to make sure that, I don't know how much data they share, but they certainly get together regularly and talk about issues that they're struggling with, dealing with, celebrating sometimes. So just wanted to make sure everybody knew that.
Thank you. Senator Marr, before we end, do you have any
I
concern?
think that, excuse me, I'm sorry, Christina, you had something, your hands up?
Sorry, my apologies, Christina.
No worries. If I could just briefly, I think there was a request for placing sort of Connecticut's CFSR performance sort of within the continuum of where do we fall compared to the national average and to other states. I think what would be particularly helpful in looking at that is how do we compare to states of a similar socio and economic status, right? And sort of within that group, how do we compare? I think that would be very helpful as well in thinking about how do we get perspective on that data. And so I just wanted to say that and hopefully that could be done, but just want to put that in the mix.
Thank you so much. And I totally agree with you. Senator Marr?
Yep. Quickly, just thank you all so much. This is certainly the beginning of conversations. We know we need more information, more data. That hopefully is forthcoming. I would also like to see where the CFSR continuum, how that falls against other states. So thank you for your time today. We appreciate coming together this way.
Thank you, Senator. I would like to request that any of the information that you have shared with us today and any more conclusive information that would be a good follow-up for some of the conversations that we had, would you please share that with Kira Smith, the clerk of this committee, so that we can distribute that information to the members of the committee. And we will announce the time and date of our next meeting sometime in the next month or so, with hopes of having something before the start of session, but not necessarily guaranteed. We do thank you for your work on all of these efforts and matters, and we look forward to us meeting again. Thank you so much.
Thank you.
Thank you.
Thank you.